So here with Stephen McConnell talking about his first case study, which was his dad and how he reversed the kidney disease, got lots of improvement, and even kept him a year alive about 10 years later, right? I saw.
Right. And it's like many things that happen that end up being a good thing. To be brief, he had a heart attack. He was in his early 80s. He jumped rope twice a day for 30 minutes. World War II veteran, real hard boiled. But I was still learning how to recognize prediabetes. So he gets 3 stents literally 24 hours after the heart attack. Made my mom miserable being mean to her because he didn't feel good. And took him 2 days because when they're that old, they don't like to work the patient too long. So he stayed a couple days extra, 3 stents. So everybody thought, oh, that's the end of it. I knew better. Although I had him on a lot of niacin and a lot of fish oil, it was a little late, right? Because I'd only had a month to put him on those 2 things. Yeah. And the disease was already taking control. So they go to Florida like they used to, and he's down there with my mom, and I get a call. She called me, and then she called my brother, and we hurried up and went down there because they were admitting him a quintuple bypass. That was out. I was trained to work in that room. Yeah. And aortic valve replacement, an annuloplasty, actually. I was mortified. And I'm down there, and I talked to the thoracic surgeon, and he knew my background, so he explained to me how they're running it. I said, look, I have no problems here. I just kind of wanted to ask a couple of questions. I said, just take care of my dad. We can talk another time. So they discharged him quite a few days later, and he was pretty stable, but I was really worried because he was already stage 1 heart failure. His ejection fraction was low. And when you look at that slide deck, a lot of stuff going on. What I didn't know then, I know now, is his TCO2 was low. I think he was 19. He needed alkali. He needed sodium bicarbonate. So he'd probably been acidotic for years.
Long time, yeah.
So I was just starting to learn more about kidneys because I was mainly focused on lipids and heart disease. But hey, that's the number 1 cause of death if you got kidney disease. So I put him on sodium bicarb, literally out of a yellow box. We thankfully had a fresh box, not the one that had been in the refrigerator forever. And spooning it out, stirring it up, 2 rounded teaspoons. That's a lot. Mm-hmm. And a handful of Tums. And Mom told him, Ken, you can't eat dinner till you do what Steve told you to do. And, he knew who the boss was, so he did it. And then his lab work kept looking better and better. And the whole issue with going to the nephrologist, we canceled. He didn't need it because his GFR went well above 15, and it kept going up.
What did it start at? They were saying he's in kidney failure. He needed dialysis.
Oh, yeah. And they were ready to plop him in a chair. And no offense to nephrology, but let's be honest. They make their money keeping dialysis chairs full. They don't really focus on prevention. They do everything with no variation for every patient unless there's some reason they can't. And they evaluate you. They're decent human beings, but if you're paid a lot for dialysis and nothing else, that's your focus. It's not true in other countries. So here he was. He had nuclear stress tests. They figured out this valve needed repair or replace. The first slide that shows his GFR is 19. 4 more points, you're on dialysis. 4 months later, it went up 27 points. You don't see that very often in conventional therapy, but I was surprised because Dr. Dave, who managed my parents, he's my best friend, ran the lipid clinic, cut me loose in there, no money. I wanted to learn and they wanted to try it. So my dad's a patient and he calls me up and goes, hey, you're going to want to see this. And I'm looking at the lab work. I'm like, holy crap, Dave. He goes, yeah, pretty cool. And he went back into an encounter. So I'm like, this is interesting stuff. 4 cents worth of sodium bicarbonate and, 5 cents worth of Tums. He was already doing 2 grams of niacin and fish oil. So we need to credit that component. But then his GFR is 46. And this is, let me get the dates straight.
So it went up from 19 to 46.
Same year. This isn't eons later. This is the same year, October. He had the bypass January 1st, right around there. And I'm like, well, when's it going to stop improving? And clearly I wanted it to improve, but I had never witnessed this before. And then we got a VAP test on him. His GFR was 50. And then the last time we actually had a measurement was 2011. It hit 61. So we're talking about multiple stage improvements. Creatinine-based GFR. God knows how good it looked or how bad it was to start with because creatinine is just horrible. It's only accurate You know that. Stage 3 and stage 4 is where you usually catch them. It's because insurance is too damn cheap to pay for cystatin C.
Yeah,
And I don't have a albumin creatinine ratio, but let's just assume it was in the toilet. He was at least A2 or A3. He was leaking protein, no question. That age with heart attack and everything else.
yeah.
And when you survive bypass, you usually become a diabetic if you weren't, and you usually finally get diagnosed for kidney disease because now people are paying attention. And the procedure itself causes risk. So when his his ejection fraction, which was right near 25, that's a scary level. When clear up to 50 on the niacin and the fish oil, I had a false sense of security, but I didn't know enough about kidney disease. But it's a wonderful story because anyone that's around me all the time, they know who I am. I'm like a pit bull, let's fix it. Then I thought, well, this isn't lipids, but it's at least as interesting. Let's look for more patients. And the main liability there was we had to depend on a creatinine list. We had the ability to use a cystatin C, which I didn't know about that till right around the time we got the last GFR in my dad. I worked for Health Diagnostic Laboratory and a couple other advanced labs, and they were promoting that it's a better test, so I started using it. But he lived another 6 years from that point, but almost a decade from the heart attack. And if he had been placed on dialysis, well, he wouldn't have lived very long.
No.
Not 5 years if he was lucky, with all that stuff he had to deal with. But I couldn't have been happier because you can't put a price tag on that. That was my dad, and he lived to 94.
And he had a better quality of life.
Oh, yeah. But, his hearing went. I have hearing aids. Some of it's inheritable. I did a lot of it to myself playing drums, but that's another story. And he started to lose his vision, macular edema, macular degeneration. But whatever he enjoyed became out of reach because he couldn't hear books on tape. He couldn't watch TV. And it was probably a blessing. He checked out at 94, and he really only lost the quality of life maybe at 92. So we bought him time, for better or worse. His wife, my mom, had him around a lot longer than he would have been if they put him on dialysis.
Yeah.
And that was a victory, no question. Now, thanks to what I learned, it's not me. I'm just an instrument of God. It's like he made me curious, so I can't stop myself from learning new things. And that was a hell of a learning moment because it fixed my dad's problem. And I thought, how many people have kidney disease? Well, now we know.
Yeah.
And
it's going to be a lot more.
I get more kidney disease than heart disease patients anymore. And of course, they get just marginal care that the insurance companies allow. And I have to reason with them. Is it worth less than half of a car payment to save your life and live longer and not miserably? Live well. Oh, okay. And you get the lab work, and then I can really do a good job because you got to have a cystatin C. And if they didn't order an albumin creatinine ratio, if I have those two things, now I know what's going on. And some of them are probably not ideal for me to be managing, but IgA nephropathy, lupus nephritis, RMND1. I got a young kid in New Orleans, but you put them on the same thing and the kidneys improve.
Mm-hmm.
You know what it's like when somebody improves.
Yeah.
That's why you do what you do.
Exactly.
If you focus on the money, you'll never focus on the problem. You're all about the money. But I focus on the problem, and the patients don't seem to mind paying me. So it's kind of cool.
Yeah. Well, I know you got that slide deck. We'll do something into a video with that to go along with this. But it's that's great how you got started. Usually, that's how I got started. My own personal experience with kidney disease. So.
Dr. Chet and Dr. Chern, they brought your name up again, and I said, "Yeah." I said, "What's more compelling than to be a patient yourself?" I said, "That's Dr. G. I'm lucky. I don't have kidney disease. I take sodium bicarb and I take Tums just because of that. I figure I've got a reserve alkali and I have an extra agent to help control the phosphorus. I want to live to 94 like my dad. And the way I'm going, I might live to be 100. I'm sure some people would rather. I'm not living that long because I'm a day at the beach. But I learned a lot. My dad, thankfully,
that's how you learn.
God gave me the opportunity not only to help my dad, but to learn from that. And then when I realized why it worked, I remember thanking William Finn, who mentored me for nothing. I'm not a nephrology fellow. I'm just a nerd. But he saw something in me and decided to teach me what he knew. His big thing was phosphorus. He published books for nephrology fellows. There's no nephrologist alive that's over the age of 60 that doesn't know him. They took micropipettes and went into a kidney in a living patient and figured out the sodium counter current multiplier. Because you got one limb, the ascending and descending. Yeah. One won't let sodium through, but it'll let water through, and the other one won't let water through, but let sodium through. I mean, God gets it right the first time. That way, it concentrated the urine, retained what you needed, but dumped everything that the kidney should be dumping. And when I introduced them to nephrologists with a job I had back then, they'd go out of their way. They'd cancel patients to see them. Because I drive him into Rochester University or wherever. Anyway, I drove him around New York because he knew more about phosphorus than anybody alive. And thanks to him, I learned a lot of these nuances. I'm not famous. I'm not even a licensed provider, but you can still help people. Mm-hmm. And Absolutely. If they're getting bad guidance, there's no harm in trying to improve upon what is normally done. Lab work is a big thing. Insurance companies should be sued up and down the street for not allowing certain biomarkers to be paid for. And you know this. The reality is you got to order something, there might be a bill involved. And if you don't order the right stuff, there's too much guesswork. And creatinine just makes me angry. I know it's a cheap biomarker, but why do they allow the continued use?